Okay, now I have the distinct honor of introducing our keynote speaker, Dr. Jeremy Schumm. Dr. Schumm completed his PhD in clinical psychology at Kent State University. During his internship, he completed rotations in the National Center for Post-Traumatic Stress Disorder, Substance Abuse Treatment Services, and Causeway Street Outpatient Clinic. He has served as Associate Director of the Trauma Recovery Center at Cincinnati VA Medical Center and Associate Professor of Clinical Psychiatry at the University of Cincinnati. Dr. Schumm is a National Master Trainer in Behavioral Couple Therapy for Substance Use Disorders, as well as a Master Trainer for Cognitive Behavioral Conjoint Therapy for PTSD. He has developed and pilot-tested the first integrated couple-based treatment for individuals with co-occurring substance use disorders and PTSD. He serves on multiple scientific journal editorial boards, including consulting editor for the Journal of Consulting and Clinical Psychology. Today, Dr. Schumm will be sharing his work in behavioral couple therapy for substance misuse and disorders and the power of relationships in therapy. Please join me in welcoming Dr. Jeremy Schumm.
Thank you. Thank you. It's a pleasure to be here. This morning's talk, I'm going to focus on a treatment that I often describe as highly effective, but people have largely not heard about it, nor do they use it. So we have a dissemination problem with this treatment. But I think it's a great treatment, and it recognizes the intersection between couples, relationships, and the impact of substance use disorders that they can have. So to set that up, let's first of all talk about, I'm going to focus on alcohol use disorder because it's the most common, but kind of setting the stage for this is an issue for military members and for veterans. So the first statistic I want to point out is if we look at the military, excessive drinking is more common for men in the military than it is for men in the general population. And that's true if we look at same-aged civilians, okay? So men in the military tend to drink heavier, in terms of higher proportion. Excessive alcohol use is estimated to cost the military over $1 billion a year, okay? It's estimated to result in the loss of 320,000 workdays for the military, result in 34,400 arrests per year in the military. It results in over 10,000 military members being unable to deploy, and 2,200 separations per year in the military. So I put these statistics up because they're pretty big, and I think that they make the point pretty well. Excessive alcohol use is a problem in the military, and it's something definitely that we need to address. So let me now shift to talking about intimate partner relationships and substance use. So historically, there's been a couple of views on alcohol use as it comes to the intersection with the family and within the family context. And there was an old theory that's been around for a while, that's a family systems theory, which says that alcohol use actually serves an adaptive function in the family, that it's reinforced by the system and it helps to promote things like emotional expression, serves as a stress reliever so that it has positive benefits, okay? So that's one view, okay? Another view is that alcohol use, particularly if it's excessive, is actually detrimental. It's not a good thing for the family, okay? So this is what clinical psychologists in particular do. We look at research to test things that seem obvious to a lot of other people, but there was a meta-analysis that was done by Amy Marshall in 2003 to look at, well, what does the data tell us about these two hypotheses? Which seems to be supported? Is alcohol use a good, helpful thing for the family, or is it maybe cause some detrimental impact? And the summary of these findings is that the research really pretty clearly supported the latter, that when you look at alcohol use disorder and you look at excessive drinking, it does have a negative relationship with relationship functioning, right? So it's not a good thing. Particularly, the research found that when the patterns of use between partners were discordant. What I mean by that is one partner drinks heavily or one partner has an alcohol use disorder, the other partner does not, okay? And we can imagine there's probably a lot of reasons for that. First of all, if you're not matched up on that particular variable, you're probably going to argue about it. The person who's not drinking is probably not going to be happy about the behaviors of the person who is. So we especially see it there. I already mentioned alcohol consumption and relationship satisfaction. So the heavier you drink, right, the heavier a partner drinks in a relationship, the more negative the relationship adjustment tends to be. And then another finding was that, where does the drinking occur? Right, so the person who drinks, where do they normally drink? And really they looked at studies to see, is that normally happening in the home? Does that normally happen outside of the home? So what would be your guess? What would lead to greater relational dissatisfaction? Someone drinking in the home or going out and drinking? Going outside, right? Exactly. So it was those cases where the partner was also going outside of the home a lot, maybe going to the bar, they come home, there's arguments, there's discontent. So that mattered as well. And then, interestingly, these were older studies that they did this, but they actually did studies where they've looked at coding behavioral interactions with couples where neither partner had an alcohol use disorder, one did, and also looking at how they communicate. They do this in a laboratory, and in some of the studies, they actually did it under conditions where the person was administered alcohol versus not. Now, nowadays, I don't even know if they would get away with that, giving someone who has an alcohol use disorder alcohol and see what happens. But nonetheless, they did this research. And what they found is that couples where one partner or both partners had an alcohol use disorder, in terms of their communication style, tended to use more negative communication style, right? They tend to be more critical, name-calling, aggressive, that sort of thing, when they're communicating about points of conflict. And that those couples tended to look more like couples that did not have an alcohol use disorder, but that were relationally distressed, right? That they had marital problems. Okay? And that, furthermore, the effects of being under the influence didn't matter. So one of the things they found is, regardless of whether it's a couple or there's an alcohol use disorder or not, being under the influence actually did increase positive strategies like use of humor and things like that. However, for couples where one partner had an alcohol use disorder, it also increased negative strategies, right? Things like name-calling, aggression, that sort of thing. So really what this tells us is that there is a relationship between couple satisfaction, how couples interact, how they communicate, and having problems related to alcohol use. Okay, so has anybody heard of the term enabling? Okay, so that's a common term. You hear that groups like Al-Anon talk about enabling a lot. Therapists sometimes talk about it. So really enabling really refers to behaviors by a concerned significant other or family member that reinforce or, quote, enable substance use, okay? So now, one of the things was that enabling was once thought of as basically showing pathology within the family. It's a family sickness, right? And there's this idea of codependency as well, okay? I would say that more recently, there's been some challenges to that conceptualization of it, and that the idea being that partners might engage in enabling behaviors, but oftentimes, so this is a different conceptualization, oftentimes it's out of concern, right? I love my partner, right? And they have a drinking problem, and I want to try to care for them, and I don't know how to do that. I don't know how to show my concern, so I'm engaged in these behaviors that I'm not trying to increase their drinking, but it does, right? And they're not even really aware of that impact. And if we look at why do people enable other people in their family, well, the consequences of that use also has consequences for them, right? If you know, my partner who's in the military gets in trouble, wow, well, that's going to affect their career. That's going to affect our family. That's going to affect our livelihood, okay? Okay, so researchers did a study of this. They did it within the VA, veteran samples. What would be your guess in terms of the percentage of couples where enabling goes on, where one person has an alcohol use disorder? More than half, less than half? More than half. You guys are right, so you're right on. So any ideas, what are some of the common types of enabling or behaviors that couples might engage, or partners might engage in? If somebody, yes?
Cover up the behaviors of the person.
Exactly. So cover up the behaviors of the person. So that's, I had to write these statistics down. I didn't have these committed to memory from the study. But yes, so 64% of the partners reported that they made excuses for impaired behavior when the person's under the influence. What else? Taking over responsibilities. That was number one. That was 93% of partners reported at some point in the past year they've taken over chores around the house. Any other guesses? Denial. Yeah, denial was on there. I don't think it made the top of the list, but definitely. So some other things. 79% changed or canceled plans because of the alcohol use or because of a hangover. 60% drank or used with the person with the addiction. Okay? We see that a lot, right? I heard about that recently. I was consulting on a case where the partner just said, I admit, I give up. I don't know how to deal with this. I'm just going to go along with it. I'm going to drink with him because then we don't fight, right? So enabling is a real problem, and traditionally within individual approaches to treat alcohol use disorder and to treat addiction, it's hard to address because we don't have the partner in the room. Okay, so that sets us up for why do we use this treatment that we call behavioral couples therapy for substance use disorders? Well, the first rationale is that substance use problems and family problems often coexist, right? So I already presented data on that. It's quite common. Not in every case, but in most cases, there's some relational problems there. So because of that, it makes sense naturally, let's help couples to improve their relationship, to strengthen their relationship, while working together as a team to reduce the substance use issue. And these sets of problems are often intertwined. What do we mean by that is we kind of think about this in this particular therapy is there is a bidirectional relationship. In other words, relationship problems can increase the substance use problems. Substance use problems can increase relational problems, and it's this cycle, right? So they're intertwined. So it naturally makes sense for us to look for interventions for how do we break that wheel? How do we break that cycle and help people get out of that? And then finally, addressing both problems at the same time, according to this model, should result in the best outcomes. Now, I think that this has conceptually shifted greatly. My colleague Tim O'Farrell, who did a lot of the foundational research on this particular intervention, has told me about when he would do kind of trainings and talks on this 25, 30 years ago, there was a lot of resistance to the idea of, you should be addressing couple relational issues early in recovery, right? The old thinking was the person really needs to just focus on their addiction and put that on hold, okay? So the problem with that is life doesn't go on hold. Their relationships don't go on hold. And by the time you get to that, the partner may be out of there. The family may be broken. Okay. So who is this meant for? What was this particular intervention designed for? Well, it was designed for couples who have substance use problems. Okay. And that's a primary, it is a couple-based treatment, but the primary, there's a primary and important difference here is that it's a disorder-specific treatment. We are focused on, first and foremost, the addiction issue. And secondly, trying to use the relationship to both reduce the addiction and help use some strategies to help improve the relationship functioning, okay? Typically, this treatment is delivered in approximately 12 to 20 sessions, usually about 3 to 6 months, okay? So it's a treatment. I'll talk about the research and the efficacy of it, but you don't have to be in it forever to have benefits for it. Benefits can happen in as little as a few months of counseling. The final point I want to make is that what I really like about this model of treatment, it fits really naturally well with most other treatments that people might receive for addiction, okay? So it actually was developed to go alongside of individual addiction counseling or group counseling, right, as an adjunctive treatment, not in replacement of it, but we can add this in. This can be, beneficial to address the addiction from a different angle. It also fits very well into self-help. So a lot of people make use of that. AA, other forms of self-help, fits naturally within that, and I think you'll see how once I start describing the model. And finally, medication. Actually, there's been some research showing that it actually helps to improve medication compliance for people with an addiction issue. And you could probably already think ahead and imagine why. If I have a partner in the room, guess what? They can help remind the person to take their medication. They can observe that. They can reinforce that. So it's a natural fit there as well. And, by the way, individuals with addiction issues often can struggle with being compliant and taking their medication. So that's a really good thing. So with this particular treatment, we have 4 objectives, okay? The first is to engage the couple. Now that seems obvious, and I won't have time today to go into the details of how to do that, but that really takes some time and effort. And a lot of what I use is foot in the door strategies. You don't want to overwhelm a couple with saying, this person's fresh in an addiction treatment program. Well, we need to do this couple counseling and bring in your partner right away. And a lot of times you get resistance to that. And I'll say too, having worked both outside and within the VA, and having worked with a combination of both men and women in recovery, the short summary of this is get to the female partner. She's the one who's going to drive the treatment or going to be the person that you need to talk to engage. And that's a lesson we learned working in the VA setting. If you talk to the male veteran and they said, oh, yeah, let me talk to my wife about that and I'll get back to you. Guess what? You're never hearing from them. They're not coming in. Get the wife on the phone. Yes.
I'm just wondering, is that true if the female is the veteran?
That's a very interesting question. One of the things, so I had this hypothesis when we started doing more research with women with addiction issues, that it was about that you needed to get to the person who had, the person who was not the non-addicted partner. That was my presumption, right? That it wasn't about gender, that it was about, well, you really need to engage that person who's the non-addicted partner to really get them involved. What I quickly learned from the women who I worked with addiction is that it seems to be actually much more of a gender thing. Because, I was surprised where I would talk to, women where it was the woman who had the addiction issue, and I'd say things like, oh, why don't we call your husband, we can talk to him about kind of just setting up maybe a meeting just to get an overview. And the funniest reaction I had is I had a woman just flat out, so she goes, no, there's no need. He will be there. You schedule the appointment with me and he will be there. And I started thinking, I need to rethink my hypothesis about this. I think it's more of you hear the hypothesis, women drive healthcare, and I think maybe that has some truth to it. So for what it's worth. Early on in this model, we want to then support abstinence with what I'll just describe here momentarily, what's called the recovery contract, and a daily ritual to reward abstinence, which feels very unusual, I think, to couples with an addiction issue to start off with. Rewarding abstinence, that's not something that I think they've often thought a lot about. And then supporting other methods to promote abstinence. Now, I say abstinence, but I should also mention too, I have modified this protocol clinically, and actually we did a small pilot study where we looked at, so this was the pilot study we did with veterans who were younger male combat veterans returning from Iraq and Afghanistan, and what I quickly found out in my pilot study is none of them wanted an abstinence goal. They all said, no thanks. Okay, I think my drinking's a problem, but I need to cut back. I don't want to quit entirely. We thought, okay, well, let's see how this goes. And so modified that goal for, in this case, individuals that were not willing to try abstinence, but were willing to set limits on their drinking in terms of drinking goals, okay? Now, that doesn't work for everybody. I should also be clear about that. There are some people that is probably not a good idea, right? And they're probably not going to be successful, others where they might be. We then also want to, in behavioral couples therapy, improve relationships by increasing positive activities, by improving communication, okay? So I talked about the research on how communication is often problematic when you have alcohol or drugs in the mix. And then finally, continuing recovery and relapse prevention, okay? So this is a time-limited treatment. So we want to set couples up for success. So when they leave treatment, they have skills they can take with them. And when they leave treatment, they can anticipate and think about, how do I be proactive in protecting my recovery and protecting my sobriety, okay? Okay, so who does this really work ideally for? Who might it work for? So couples who are married or living together, okay? Now the requirement there is really, you could possibly do this with couples where they are not cohabitating. It's a little trickier, I'll say that, because this therapy is a very kind of intensive therapy that does require daily interactions between the couples, okay? And it's just a little bit harder to do if they're not married or living together. The other thing is, too, there's maybe not that degree of commitment that you see, for example, in a married couple, okay? So, and I would say even more ideally is couples that are married for more than a year, right? Because then that's showing at least some degree of relational stability. You know, it's less than ideal where you say, you know, a veteran who comes in and says, well, I'd like my partner involved and, you know, she's the love of my life, but I met her 2 weeks ago. Now, maybe that's true, right? But then again, maybe that's not going to be a relationship that is stable enough to last for 6 months. So that's really the idea. So separated but considering reconciliation, that's possible. So I mentioned that living separately. And you see that a lot of times couples, when they present for this sort of treatment, you know, it's either the last straw, right? Like I'm willing to consider giving this a try, or, you know, he's gone off and he's gone on a bender and he's drank and I made him move out or I've moved out. And my condition is he stops drinking and that we work on our relationship to reconcile. Okay, so if there's a commitment toward that, that's a possibility. So willing to try abstinence. So, you know, this is one of the things we want to encourage people, abstinence goal. It simplifies things, and for many people, particularly people who have more severe addiction issues or particular types of drug issues, it makes their chances of recovery much better, okay? As I mentioned, though, that's not for everybody, right? There are some folks that are, particularly I think are younger men and those active duty or, you know, younger male military veterans in particular who are like, well, you know, I don't want to give it up entirely. So in that case, we could try out a controlled drinking goal. If both have a substance use problem, so again, this is one of the things where this is why you do research, because you have ideas about what would work, you know, when couples are more or less challenging, when would this work, not work. And we had the hypothesis that when both partners had a substance use disorder, that's going to be harder to treat, right? Seemed reasonable, because if one partner starts going off and using, they, so to speak, might pull the other partner out of the boat with them, and now, you know, they both relapse. That was our hypothesis. But when we actually looked at the data, we had some data from various studies where both partners had an addiction issue. We actually found no differences in outcome. That it seemed to benefit similarly couples in which both partners had a substance use issue. Okay. Now, I should say that's special cases as well, because these are couples where both partners are coming in saying, I'm willing to work on my addiction, or minimally, I don't want to work on my own addiction issue, but I want to really support my partner in his or her recovery. Okay? I won't put that on the table for now, my own use, but I'll support them. Those are the requirements in those cases, right? Where it's a case where a couple where one partner is like, no, I don't think it's a problem, and I'm not really, well, this model doesn't really fit then in that scenario. So yeah, both partners need to be willing to work on their problems. So it's important that both partners understand this is a team effort. Even though, maybe one of you has the addiction issue, it is a team effort, right? It affects you both, and the greatest chance of recovery is if you work together and you work well as a team, okay? And sometimes that may need to take some counseling and coaching, because you might have partners who come in and say, well, I'm here because I want you to fix him because he has the drinking issue. Well, that's not really the way this model works. We need more of a collaborative stance there. Not high risk of very severe violence. Okay, well, what do we mean by that, very severe violence, and why is that a criterion? Well, very severe violence would be things that could result in serious injury or death, right? Because those are very high-risk cases, and oftentimes, depending on the nature of the violence, that type of violence can look very differently from other violence we might see in a relationship. And I want to be clear, I'm not excusing at all partner violence. As a matter of fact, we take a very clear no-tolerance policy in this therapy to violence. But what would you guess, what is the percentage of couples who present for treatment that if you assess them appropriately using validated measures, will report past year physical violence? Any guess what the percentage is? This could be, and this is just for general couples therapy. It's high, yeah, so I heard high. So you guys are right, yeah, so I was maybe being also a bit rhetorical. It is high, right? It's somewhere around like maybe 60-65%, the data shows. So if we excluded all those couples, we have, not the majority of couples left, number one. Secondly, there is some very clear research that links substance use to violence, and that actually shows that if we effectively, whether it's in individual therapy or in couple therapy, if we effectively intervene to reduce substance use, that actually greatly reduces risk of partner violence, okay? So, and the types of partner violence that are most common when you see couples that present for this are things like person was intoxicated, they're trying to leave the house, the other person's fighting to get their keys, they shove each other, this sort of thing, pushing, grabbing, maybe slapping. We clearly and very immediately take a quick effort to reduce violence risk, but we also want to acknowledge it does happen, and it may be actually, in fact, related to the substance use in certain cases. We ideally would want the person engaged in a broader recovery program. So again, this is an adjunctive treatment. Now, I've done it in cases where couples have said, well, because of various resource limitations, I can't do that, I can't afford the multiple trips, this sort of thing. But I will regularly encourage my couples, have you tried self-help? Have you gone, let's look at individual counseling. Let's look at, if they need a higher level of care, let's look at that as an option. And that behavioral couples therapy can start as early as if somebody's in an intensive outpatient program. And, they're really starting very early in their recovery. Fits well there. So what are successful therapists for this particular treatment? So successful therapists are ones that, first of all, address the substance abuse problem first, okay? A lot of times couple therapists that pick up this model fall back into kind of their general couple counseling mode, and that's where I think things can go astray. right? Like if you really need to stay focused when there's an addiction issue on stopping the addiction issue first, because it is really hard, if not impossible, to improve communication in the relationship if somebody's continuing to use alcohol or drugs. Just does not work well. The ability to tolerate and diffuse strong anger. Guess what? Partners are going to come in. They're going to be angry about things that have happened. Things that have happened in the relationship. So you have to have an ability to diffuse that. And these couples are couples that tend to escalate in conflict at times, right? So being able to be proactive to diffuse that and tolerate it. Being able to structure and control sessions. It's a very structured treatment. So one of the things I'll tell couples is, I ask them, before we start the therapy, have you been in couple counseling before? What's your expectation for that? A lot of times it's usually kind of a process-oriented type of approach, right, which works well for general couple issues. But what I'll explain to them is this is a very structured treatment. It's going to feel very different, okay? Each week we're going to have an agenda. We're going to be focused. This is to teach you skills to help you battle the addiction and to improve your relationship, okay? So setting that expectation correctly. Having the ability to readily empathize with both partners. That can be an issue for counselors generally in couple therapy. Tend to side with one person or the other. Well, I really relate to that partner and not that one. You got to stay balanced. You got to look at seeing both people's sides and not side with one or the other. And addressing non-adherence to the protocol with flexibility and problem solving, right? So you don't, somebody comes in, they haven't done their out-of-session work. You don't want to make them feel ashamed, right? You want to be realistic, and you want to help them to be realistic about where they're at in their lives, and balance encouraging commitment and follow-through to the treatment with things happen. And, I understand that. Okay, so research on behavioral couples therapy. So by the way, if we look at psychotherapy research, there's not a ton of examples. There are some, but there's not a lot of examples where we see, compared to bona fide, credible treatment, where one treatment works better. This is a case where, in fact, we have very clear evidence for that, where behavioral couples therapy, in fact, does work better than traditional individual therapy. And when I say that, that could be, they've done studies where it's comparing it to 12-step oriented addiction counseling approaches that's individually focused. They've compared it to cognitive behavioral relapse prevention, which is an evidence-based treatment, found that if you add in behavioral couples therapy, people tend to get better outcomes. And what they find is better substance use outcomes, so things like lower percentage days of using alcohol or drugs, lower problems related to alcohol or drug use following the treatment versus other types of treatments. And that also is true for relationship outcomes. For those that are not researchers, and I won't bore you in going into a statistics lecture, ES is effect size. So anything that's kind of small to medium or larger is considered to be kind of a meaningful effect size difference, but I won't bore you further with that detail. Partner violence, there's evidence, and Murphy and Ting reviewed the evidence on this, that partner violence tends to be reduced after behavioral couples therapy. Pretty big effects there. The research is really mixed, though, honestly, whether is it behavioral couples therapy that uniquely adds an advantage to that, or is it if we just give people good, credible substance use treatment, that risk goes down. The good news is it seems to be kind of a broader thing that even in individual treatments, we see risk for violence go down. So that actually is a good thing, even though behavioral couples therapy doesn't seem to be necessarily superior in that outcome. Possibly efficacious for non-romantic family members. So I'm citing Tim O'Farrell's study that he did that was a small randomized controlled trial. This was a study where it was not romantic dyads, but it was adult children, late teens, early 20s, usually with an opiate use problem, who had a parent who wanted to be involved in helping their child. And they found, similar to studies of romantic dyads, the individuals who received behavioral family therapy actually did better, right? So those young adults who had a family member involved, not a romantic partner, but some other family member, usually a parent, tend to do better than those that just received individual treatment alone. I will also say possibly efficacious for reducing co-occurring PTSD. So we have a study that's in press where we looked at that in a randomized controlled trial and found that PTSD symptoms were reduced when you added behavioral couples therapy versus if you just did individual therapy. So a lot of veterans and military members have co-occurring addiction and PTSD. So I think that's a really important finding. And as I'll talk about more in my talk in the afternoon, I suspect a lot of that has to do with improving social support, okay? Because if you're you're really working to improve social support, that's a very powerful, variable to improve PTSD symptoms, okay? And then we did integrate this treatment with the treatment I'm going to talk about later on, did a small pilot study, and found good outcomes in terms of reduced days of heavy drinking. And again, this was with a younger male veteran sample. And reduced PTSD symptoms. And in this study, we actually found partners of the veterans. And this was male veterans, female partners. The female partners also had reduced depression symptoms. So there's also, I think, some mental health benefits there potentially for the partners as well. Okay, so now I'm going to get into talking a little bit about the protocol to give you just a brief summary of what does that protocol look like. So the typical session looks like the following. So that you start with, because it is, again, a disorder-specific addiction treatment, you start with reviewing substance use or thoughts or urges that someone has had to use. Okay, that's the first point of review. Because, again, going with the philosophy that unless we're really addressing the substance use up front, the relational element of interventions, trying to address couple communication, things like that, is not going to go well if somebody's had, last week they had a major relapse, right? We got to address that first. Then we review the home practice, okay? This is like any of these what are called cognitive behavioral therapies, right? Which are therapies that focus on changing the way people think or their behaviors as a way to address the problem. Like any of these types of therapies that fall in line with a cognitive behavioral approach, there is outside practice, okay? So that's another difference. Like sometimes couple therapy might have that, other times it's just we show up once a week and we talk about how to improve our relationship. But here it's very explicit. And the theory is that if we're not applying the skills outside of the therapy room, the therapy is going to have limited benefit, okay? So we need people practicing these skills at home. Reviewing then any pressing relationship issues. Then we introduce and practice the new skill. Now this is done in a very specific way, typically in behavioral couples therapy, and it's done in this manner. I'm going to explain what the skill is and the rationale for it. I'm next going to show you how to do that. I'm going to model it. Now I want the two of you to practice it in session. I'm going to give you coaching on that, okay? So explain it, show it, do it is kind of the sequence. And then we assign home practice assignments, what to do for next time and answer any questions that the couple might have. Okay, so gaining commitment. So how do we do that? So non-threatening positive approach, right, to get the patient's permission to contact the spouse. I already talked about that, right? We want to talk, especially to those female partners. That's one of the things we learned in the VA setting. We want it to be positive. Sometimes we might have someone who is entered inpatient addiction detoxification, and you approach them and say, why don't we get your spouse on the phone? And guess what their thought's going to go to? What are you going to tell her? You're going to tell her how bad of an addict I am. You're going to tell her all the terrible things I've done. You want to take a positive approach, right? So the approach I usually use is, why don't we get your spouse on the phone? And we'll do it together so you can hear what I'm saying. and to let her know what a good step you've taken to come here and get help, right? Because I want her to hear that and to know you've taken positive steps, right? So start with a positive approach. Talk directly to the spouse, and then gain small steps for commitment. So this is where I talked about foot in the door, right? So, people are more likely to give a commitment to something that doesn't seem like a big deal to start off with, particularly if they're unsure, right? So let's start with kind of very non-threatening small commitments. And again, if you're doing this, we did this a lot. We would recruit people from the inpatient addiction treatment program at the VA. And so we would go there and say to them, kind of a standard part of your discharge is talking to family members about, the home environment and making sure you're set up for success. What do you think about bringing your partner in? I'd be willing to kind of help facilitate and meet with them to do that, okay? So that's small commitment one. You're not committing to anything beyond that, just discharge planning. Next, if it seems appropriate, you might say to them, let's meet for an informational session. There's this treatment that I think really might fit for you, right? It's called behavioral couples therapy. It really is a positive treatment to promote recovery, to improve communication. No commitment, to do it, but would you want to hear more about it? Why don't we set up a one-time meeting to see, okay? And then following that with a couple intake session, because you do want to screen your couples and make sure, are they appropriate for fitting the model, okay? So all of these are steps before you would ever ask the couple to commit to, a full course of behavioral couples therapy, okay? And I think that those, and by the way, actually, Tim O'Farrell did research showing that approach is actually the most effective approach you can have in terms of trying to engage couples. Okay, so here's kind of right off the bat, we have some seemingly simple promises that kind of set the stage for behavioral couples therapy that we ask the couples to commit to. Okay, there's 4 of them. No, first of all, not threatening divorce or separation. Why do you think we would ask them to try to commit to that during the course of behavioral couples therapy? So we don't want you to threaten divorce or separation outside the session. You think that happens maybe with some of these couples? Right? Happens a lot. You talk to couples where there's an addiction. Sometimes I'm not really meaning that. I'm saying something I don't mean, but I want you to know how mad I am, how fed up I am. Why don't you just leave? I'm going to leave. Okay? What does that do to safety and stability of the relationship? It really undermines it, right? I don't know if you're serious. Are you serious this time? Are you not serious? So we ask them, let's work on together eliminating that behavior, because we don't want this. And if there's a serious discussion of that, come to the therapy session and let's talk about it, okay? I don't want you doing that outside a session. No violence or threats of violence, okay? That's a commitment they're making. And by the way, we check in about the promises every week. How did this go? How did this go? How did this go? So we want them to know that that's an expectation. There's no violence. There's no threats of violence. We're going to do some strategies to help you to reduce that, but you have to commit to that being a goal, okay? Focusing on the present and future, not the past. You think couples with addiction ever bring up the past? All the time, right? Remember what you did? You ruined Thanksgiving. You showed up drunk and you made a scene. So the reason we're doing this in this therapy is because we don't view that as a productive strategy for how do we start to heal and move forward. Now, that doesn't mean we never talk about the past. Right? You may make room for that in the therapy session, but you don't want couples spinning out of control and getting back into these old patterns of arguments where it's like, I'm going to bring this up again, and then it escalates, and now we're arguing, and now we're violent. And then completing agreed upon assignments, right? So that's where I want it to be realistic. What do you think? So here's what I would recommend that you try next week. Is that realistic? Does that fit for you? If it doesn't, that's okay. Let's just be clear about what you're willing to commit to. And one of the reasons we do that is because oftentimes with addiction issues, there's a lot of broken promises. A lot of times where things have not been followed through. So we want to start to change that dynamic. Okay, building support for abstinence. So we develop with the couples the first few sessions what we call the recovery contract. So that's to rebuild trust, to reduce conflict about substance use, right? I know what my role is, you know what your role is, we're agreeing upon that, and to reward abstinence. Now, I'm going to show you an example of this, of how simple it is. Show you a very brief video clip. But this is one of those things where honestly, so my colleague, Tim O'Farrell, honestly, he stumbled upon this. He was doing research back in the early 1980s where they had couples in a group and they were doing observed administration of antabuse, which is a recovery medication for alcohol use, where the partner would observe the veteran take the antabuse. Well, what they found is, not everybody's medically cleared to take antabuse. And he started thinking about, what do I do with these people? They can't take it. So we got to come up with something. So he came up with this idea of a trust discussion. And what they found over time, and what couples started reporting is, this actually really was a meaningful, very meaningful ritual, very powerful change strategy. So it's as simple as this. The client saying, I've been alcohol and drug free for the past 24 hours. I plan to remain alcohol or drug free for the next 24 hours. Thank you for listening and being supportive of my effort. And then the partner saying, thank you for staying alcohol and drug free for the last 24 hours. Let me know if there's anything I can do to help. That's simple. We want to keep it simple. It's a daily commitment. Okay? Now, you could see, for those familiar with kind of more of a 12-step philosophy, fits well. One day at a time. You hear about that a lot in AA. I'm just going to take it one day at a time. Here, we're taking it one day at a time. Okay? And what are we doing? The person with the addiction saying, here's my commitment today, I'm putting it on the table. So that the other partner can be reassured of that. Because that's the other thing, too. Questions about, partners have about where do they stand today? Are they intent on using or not? Okay. So you guys can guess what era this clip is from based on the dress. But I just want to show you a very simple example of a trust discussion.
In terms of talking about staying sober every night, did that happen for your sobriety trust discussion? Okay, great. So remind me again, what is it that you've been saying, Tim, to Kathy?
What it is I'll go up to her and I just say my intentions anyway, which to stay sober for another 24 hours. And I'll give her a hug.
So why don't you do that now? Just tell her, what you'd say if I wasn't here.
Right. Kathy, I plan on staying sober for another 24 hours. Like I said, I'd give her a hug.
Right. We won't have to do that part. Okay. And then what do you say, Kathy? And say it as if you're right there doing it with them now.
Thank you for staying sober. I really appreciate it.
Okay. Very simple ritual, right? But notice there, you could tell just by the partner's reaction, that was meaningful. She reached out, she held his hand. Partners can personalize this, couples can personalize this. Some couples will say a prayer together. They might read, a passage from the big book or from, the Bible or something like that. So that can become part of it as well. It can become very, very, very personalized in a way for them to bond around it. The other thing that I love about that intervention that's I think is simple but elegant is that is not the way most couples have communicated around the addiction issue. It's been arguments, it's been you used again, it's been a very punishing, negative interaction that they've had. So this is changing it, and let's focus on recovery. And let's focus on your commitment and my commitment to you and our commitment to the relationship. So it really changes the dynamic around that in a very simple way. So the recovery contract includes this: daily trust discussion. The clip I showed you, the person was not taking medication. It can be done with medication. Someone's on recovery medication, they might say, I want to tell you my intention is to stay sober or that I've been sober for the last 24 hours. My intention is to stay sober for the next 24 hours. I'm taking my medication that you can see to also show you my commitment to that. And then guess what the partner does? Good, they're taking their medication. Like, I know where they stand. They're not going to argue about that, hopefully. Focusing on the present and the future, not the past. So that's one of the commitments. Self-help involvement. Not required, but encouraged, right? So we might ask the person with the addiction issue, you willing to attend AA or, give some other self-help a try? When do you think you'll go? How many meetings a week? What do you want to commit to on this contract? So that the partner knows as well and can support them in that. And for the partner to get help, right? Have you tried Al-Anon? Is that something you'd be willing to try, right? That could give you some additional support in terms of, for your own well-being. If there's a drug use disorder, weekly urine drug screens. That's fairly standard in a lot of addiction counseling. Here, again, we're not using it, we're trying to not use it in a way where it's like, ha-ha, I caught you, you used again. But rather, more of positive framework, right? So that partners might say, you know what, he's telling me he's not using drugs, but I don't know that I believe him. It's other evidence where, there's a negative urine screen. We could say, okay, so, that shows that, they've been meeting their goals, and it's reassuring to the partner to see that. There could be other weekly behaviors. I have couples who say, we also want to commit to exercise. We want to commit to riding our motorcycles. We want to commit things that you want them to think about. What are things that you think are really central that would support your recovery, that you want to do on a weekly basis, that are going to help with that goal? And then there's a calendar to record the progress. So this is the other thing too. It takes advantage of what we know from assessment. If you really start tracking and assessing behavior, people change their behavior in response to that. And here we're using that in a positive way, right? So we ask couples, we want you to record on a calendar each day when you do the trust discussion, just put a check mark. Now, as a therapist, that's helpful to me because I can just say, oh, show me your calendar. How did this go? Oh, great, you did it every day this week. Or, wow, okay, you did it every day. Great. Saturday you didn't do it. Tell me about that. Rather than, what happened last Tuesday? I don't know. I don't remember. They can record on the calendar when they're attending AA and when there's positive or negative drug screens as well. So it helps the couple to see their progress. So other support for abstinence. So reviewing urges to drink or use drugs, we do that every week. We involve a crisis intervention session if there's been substance use, there's been a relapse. So this is a manualized treatment, meaning we follow a protocol every week, but therapists also have to be flexible and reasonable, right? When drug or alcohol uses happen, you don't say, well, good luck with that, so let's talk about communication today. No. We need to address the addiction issue. We need to look at what can we do to stop that cycle. Discussing exposure to substances, including alcohol in the home. Okay, that's an important discussion. You're going to keep it in the home. You're going to get rid of it. And then addressing other stressful life problems. We can do that collaboratively using problem solving. And then finally, identifying and stopping enabling. I showed you how common that is. Now we have the partner in the room. We have a much greater chance at being able to do that, which may explain some of the success of this treatment. And then this is what, when you have a couple where both partners have an addiction issue, this would be an example of what a recovery contract would look like, okay? But it's a contract that's signed by both partners, it's signed by the therapist, and we tell the couple a couple of guidelines. First of all, if you don't do the trust discussion 2 days in a row, call the therapist. Because guess what? That's maybe an early warning sign things are getting off track. Maybe relapse is going to happen. And secondly, do not make unilateral changes to this. You've agreed to your partner to make a commitment to do this. If you want to make any changes, let's discuss it in session. Okay? Let's not do this unilaterally. And then I just put up here, this is, if we had both partners had an addiction issue, we would just have a calendar for each partner. Okay, so relationship focus. One of the things we want to do in this model is to increase positive activities. And we do that through a couple of methods. These are methods, they are not unique to behavioral couples therapy for substance use disorders. They've been used traditionally in couple therapy more broadly. Catch your partner doing something nice. which I'll show you momentarily. Shared rewarding activities, okay? What can we do together we both enjoy, that are sobriety focused, that kind of get us back into that routine, and a caring day assignment. And that's, I'm going to do some sweet gestures to surprise you. Not going to tell you about it, but I'm going to do it like a, day where maybe I'm getting you flowers and cooking a nice meal, and this is all a surprise, right? And again, why are we doing this? Well, a lot of times with addiction issues, positivity has really declined, right? And I also tell couples, if you're together for a while, some of this stuff you start to, get in bad routines and not do this as regularly. So an example is catch your partner doing something nice. Pretty simple. I mean, it's basically each day, I want you to notice one thing your partner did that you appreciate, and I want you to tell your partner about it. And then write it down so I know what that is when you bring that back into session. One of the things we tell couples is, first of all, with addiction sometimes can take over. It can push to the side us even noticing positive things that our partners are doing that are normally normal daily things. Secondly, I use the example of I say, maybe the first time you were together with your partner and they took out the trash, you were like, oh, that's so sweet, so nice you did that. By the 1,000th time they've done that, it fades into the background. It's part of your routine. You're not even noticing really that that's something that they're doing or acknowledging them for that. So this is a way of increasing positivity in the relationship. And we know from general couple therapy that approximately for every one negative exchange we have, we need about maybe 5 positive exchanges to offset that. So this is a way to try to increase that ratio as well, okay? Now, I'm gonna skip this. The slide, the video clip was just to show you this, but it's pretty simple. I'm gonna skip it so we have time for questions. But what you would do is you would have the couple, when they come in for session, share a couple of things with each other. What are some of their favorite things, and then look at their list. And it's kind of a nice thing to set the positive tone for the therapy session. So increasing positive activities. So this is really important when we have addiction within the relationship, because first of all, the addiction might have taken over and we're not doing positive activities that we used to enjoy. Secondly, sometimes couples get together and from the beginning, they're using together. And we don't really know, how do we have fun without alcohol and drugs involved? So this is a way to start to get them to be able to think about that and get into routines to schedule things that they enjoy. Now, you could have partners list out the activity, but you want them to agree at least one thing per week that we're going to do together. That's a shared rewarding activity. And this is where this could be a very family-focused intervention. It could be just we're having a date night together. It could be we're involving the kids. It could be something we enjoy doing together in the house, outside of the house. You want to be flexible and help them figure out what fits for them as a couple. And we want to link this to their recovery, right? So these are things that as we start to do this gets into routines that as a couple, we're starting to enjoy sobriety together, right? We're learning how to be a couple again, where we're doing activities that doesn't involve drinking or drug use, and that's enjoyable, and then increases our relationship satisfaction. And then the therapy involves a variety of relationship-focused skills, okay? So we teach couples basic listening skills, paraphrasing, right? People think that's easy. It's not easy. That's why we teach people, really, especially when you're having a difficult conversation, you really want to use this. You want to both speak in bullet points and let your partner respond, and the partner to reflect. And guess what that's going to do? It's going to help to make sure, first of all, your partner understands that you're listening to them, which can reduce conflict. Secondly, sometimes we get it wrong, right? Even basic, and that's okay, because if you're doing paraphrasing, your partner could say, that's not quite right, this is what I meant. And it can really avoid a lot of miscommunication and arguments by just using that. How do we express feelings directly? Oftentimes people with addiction issues and couples with addiction issues, maybe avoid expressing their emotions, right? I'm angry at my partner, so I'm not going to tell her. I'm just going to go down to the basement and drink, okay? So we need to learn a different way, right, if we're going to improve the relationship. So when you're upset, how do you express feelings directly and appropriately? So we teach them ways to do that. And we also have them, in this part of the therapy, start to work on this in what we call communication sessions. So these are just times that, a few times a week, I want you to sit down with your partner and really focus on applying this communication sessions, okay? TV off, phone down, don't be on your phone texting or on, Facebook or whatever. Look your partner in the eye and let's communicate, okay? And then finally, negotiating for requests, right? So that could be hard. Sometimes people they go between totally passive and then totally aggressive. And it's like, well, how do we negotiate for things that we would like to change in the relationship, but in a way that's respectful of our partner? So we teach some skills for that as well. So communication sessions, I mentioned, planned, structured, should be face-to-face, no distractions. So people with young kids, I'll just suggest to them, maybe is there a time, maybe before, like after you put the baby down, or does the baby take a nap regularly, or after your kids go to bed, where you might be able to focus doing a communication session. That might be the best time, and that where you're able to have full attention to that. You want to you have each partner take turns, right? So I'm going to communicate, you're going to be the listener, now we're going to switch. You're the person who's the speaker, and now I'm the listener. And when we're looking at resolving issues, it's not to win a conflict, right? Like, I've won, I've made the better argument, right? That's not our goal. Our goal is to resolve the issue, not win the conflict. Resolve the issue could mean we agree to disagree, but I heard you, you heard me, we're respectful of each other. An important thing that we also teach couples here that really is integral to, I think, helping to reduce partner violence is what's called timeout, okay? So a timeout, now, what I tell couples, especially couples with younger kids, this is not timeout you use on a child. Go put your nose in the corner, I don't like what you're seeing. It's not going to help resolve a conflict. This is timeout, like I often use a sports analogy. Think of a sports analogy, right? The team needs a timeout to regroup, okay? So first of all, either partner can call it, right? But you should say, I need the timeout, not you need the timeout. Because if you need the timeout, how dare you tell me that I need the timeout? Then it's going to escalate, right? So, I'm requesting I need a timeout. We want both a verbal and nonverbal signal to call a timeout. Now, there's a reason for that. Sometimes when we get angry, it's hard to get our words out, right? So this is a good verbal signal for a timeout, right? Pretty simple. So, I'm not getting my words out, but I know if I do this, my partner knows I'm calling a timeout. And during the timeout, you should use strategies to reduce your anger. This is also important psychoeducation for couples, because a lot of couples have the idea that, I need to get my anger out, right? So I'm going to go listen to aggressive music and hit the punching bag. That actually, research shows that actually increases your anger. Don't do that. So during, not that exercise is bad. Exercise is good, but during that moment, you don't want to be doing something aggressive. So maybe go on a walk, use, deep breathing, listen to relaxing music, do things that are calming, and think about how can I effectively communicate to my partner using my best communication skills in a way that they're going to be able to hear, my concern. What do I need to say to them? And then you have to, when you call a timeout, you need to have an agreed upon time period, right? Like, I need 10 minutes, right? Ideally shouldn't be longer than like maybe 10, 15, 20 minutes to begin with. You can call a timeout. Things escalate again, call another timeout, okay? This is where couples, you start to explain this, and a lot of couples go, oh, yeah, we do that. And then I get to this part, and I say, so do you have an agreed upon time? You come back and, oh, no, we don't do that part. Well, so then my metaphor is, so that would be like, in a basketball game, the team calls a timeout, and then they just leave the court. That's not calling a timeout, that's quitting. So let's not quit. We want to reconnect and regroup, Okay, and then, and then as I mentioned, that's a very important one, especially for high conflict couples or couples where they just are highly avoidant. We don't talk about it. We don't want things to escalate. People will feel like, oh, this is a way to put the brakes on things. A lot of couples say to me often, I like that. It's allowed us to talk about some difficult things with parameters around it so things don't go off the rails. And then I mentioned this therapy on the back end builds in things like what's called a continuing recovery plan, right? So we've done all these skills across the therapy. What are things you want to take with you? What are things you want to continue to practice that you think are helpful, that would continue to promote your sobriety and improvements in your relationship? We talk to couples and we help them develop a relapse prevention plan, right? So things like, what are some upcoming high-risk situations where relapse might be a real problem, a real challenge? Big one is weddings, right? Well, we have this wedding coming up, and usually I drink. So let's have a plan for that. How are we going to handle that, right? Being proactive. What are early warning signs? Now, this is where this treatment has a huge advantage over individual treatments, right? Individual treatments, you're asking the person with the addiction. We still do that here, right? What are your warning signs? Things you notice that maybe change before you start using, right? Well, I start getting more angry, or I start doing, other things. Partners can be very helpful. They'll say things like, I notice you start to isolate more. And the person with the addiction will say, wow, I didn't even really notice I do that. Okay, so that's maybe a warning sign. That's maybe something we need to talk about. Do we need to ramp up some strategies to change that and to reduce the fact that you're isolating more? Maybe we communicate more. Maybe start attending more meetings in that situation. And then finally, an action plan. So we don't want relapse to happen. Unfortunately, with addiction issues, it's common. So we let our couples know that, and that the action plan, we kind of compare it to a fire drill. Just because you do a fire drill doesn't mean there's going to be a fire, but it's better to have a plan of action. Okay? So what do we do if relapse happens? How does the partner stay safe? Right? Where do they go? Who can you call? Right? How do you get back on track? So this is a good manual. So again, my colleague Tim O'Farrell is the primary author of this manual, and it's has a lot of good handouts, very structured treatment if you're interested in learning more. And here's my contact information if you're interested in contacting me about this. That's all I have, and I'll open it up for questions. Sure. Yeah, so the question was to talk more about the idea of codependency and how that impacts treatment. And I think the term codependency has been historically used with this idea in mind that both partners are essentially have this kind of, like addiction issue, or both partners, one person may be using, but the other person also has a dependency issue to the alcohol or drugs. And where I've seen it is historically, it's been used in some cases from kind of a family systems perspective to say, well, you both kind of have this sickness or this illness. But I think more broadly, I mean, that, for me, the way I kind of relate it is, it may relate to, it's hard for us collectively to get out of this pattern, right? And so we both have our entrenched patterns, and some of that may involve enabling. And so in addiction, and particularly in this model, we need some skills and strategies to do that. Now, in some cases, it may also be helpful for the partner, for example, if they're, there could be some dynamics where removing that addiction issue, the non-addicted partner may say, I don't know, I'm scared, I don't like that, right? I'm scared what's going to happen to our relationship. And so both discussion, I think, in couple therapy around that, and also in some cases therapy, I think could be a good thing if you have more complex issues. So I should have thank you for that question. So what about women in the military and alcohol use? The research suggests that in some service branches there may be higher rates of excessive alcohol use for women, but it's not as consistent as for men. So I think the research, I'd have to go back and look, but I believe it's maybe Marines, and forgive me if I'm giving the service branch wrong, and if you're in the, I'm just, but I think it was Marines, and maybe it was like 2 of the service branches, Marines and perhaps Army, where women had higher rates of drinking compared to same-age women, but not the others. If you look at the other service branches, the rates of excessive drinking were not higher for women in the military versus civilian women. So, but it's more consistent for men. So that's what I would highlight, but thank you for that question. Yeah, so the question is, what about with young kids and involving them in therapy? And I think it's a great idea. I think that could be a really important addition, right, if we're looking at the broader family system. The other thing, too, there's been some work done both with this model and with cognitive behavioral conjoint therapy for PTSD, looking at adding elements of like parent management training, which is an evidence-based treatment, especially good for younger kids, that may show some added benefit. So I think that mixing that in, I think that's actually a really good idea, because this certainly goes beyond. The other thing is too, these skills can generalize, right? I didn't highlight that, but catch your partner doing something nice. Good thing to do with kids too. Reinforcing your child for things that you appreciate they're doing can be a really good parenting strategy. So that's the other thing I think with young couples with younger children, you want to highlight the generalization of those skills, or how you're communicating. So the question is, are some people not able to finish out? Yeah, because the alcohol is kind of taken over. Yeah, and I think that statistic I showed where it showed separations, there's like 2,200 they estimate per year in the military that are discharged from the military because the alcohol has interfered with their capacity to continue. Yeah, so she's highlighting that there are differences between the branches in terms of chances that you get for having an alcohol-related incident. The policy is different between the branches, and then all have no tolerance for other than alcohol. So that's thank you for pointing that out. I think it's always simpler to be, I'm your couple therapist, and then you're seeing another primary therapist. I have seen it done in addiction settings, and this is where it's balancing multiple roles. Like there are places where there's not enough therapists, and where you might be seeing someone because, well, what are the other options? Well, then they don't get one of those treatments. But being careful about, as a therapist, balancing multiple roles between, if I'm going to see you in individual recovery counseling for your addiction, and I've done that actually, where it's been, the ground rule is we're not going to talk about your relationship, right? We're going to talk about your individual addiction issues, and that having an understanding of like anything relational that you bring up, we're going to talk about in the couple, right? And then and that there's some transparency there, but it's harder to. It's just cleaner to not do it that way if you don't have to.